Welcome to Female Heterosexuality presentation by Sydney, Khaled, and Brittany. In this presentation, we're going to talk about female heterosexuality during the Cold War, and we'll compare that to nowadays and the future. Our objectives for this presentation, first we will be defining the heterosexuality, then we'll talk about differences in fatherly physicians as sex instructors from past to present, then I'll talk about the right kind of sex in the past and present, then show the differences in pelvic exams from past to present, and then finally we'll talk about the fears of pelvic exams and the premarital exams in the past and present. Let's begin with defining heterosexuality. According to Wikipedia, heterosexuality is defined as the romantic attraction, sexual attraction, or the sexual behavior between persons of opposite sex or gender. Lewis' article, The Premarital Pelvic Exam and Heterosexuality During the Cold War, talked about how important heterosexuality was during the Cold War and how successful marriage helped in a stable, strong nation. According to Lewis, the basic unit without which few societies can survive, based upon discipline and control of sexual life, sexual behaviors were considered indicator of psychological health.
Fatherly physician as a sexual instructor before. Physicians believed they were the best guides for young couples seeking a mutually satisfying marital relationship. Sex education that was offered by ministers, parents, and schools was seen as incomplete and misleading according to physicians. So, the physicians came up with a program of cooperation between the physicians themselves, parents, and schools that would remove conflicts about the sex side of life. This program would equal better marriage and normal attitudes towards family life, which would help to increase the psychosexual health of individuals and decrease the rising divorce rate. Physicians also offered an anatomical and medical advice, as well as being a father confessor to patients. Physicians were seen as equipped to do premarital counseling because of their broad medical and cultural education. Fatherly physician as a sexual instructor after. Sexual education can be taught by schools, parents, and physicians. But parents are seen as the most important sexual instructor. A child's exposure to information about sex begins much earlier than parents imagine. Speaking to children about sex early means parents have control over what and how kids learn about sex. Physicians nowadays' main priority is the medical aspect of patients. However, physicians can recommend therapists or counselors to patients who need them. Nowadays, couples go to marriage counselors to work on their marriage and get advice. The whole point of marriage counseling is to resolve conflicts and to improve relationships in all.
Lewis talked about the right kind of sex in her article. She said that the physicians place great importance on the woman's transition into marital heterosexuality and talked about the factors that affect the female heterosexuality. Sex knowledge and experience was another concern for physicians during the Cold War, as many marriages failed because women weren't getting ready for wedding nights. In terms of gender pleasure, male's orgasm was considered a biological necessity for the preservation of species, but females' orgasm was considered a goal. Even people from different races or classes experience sex in different ways. All of this leads to our next point, which will be explained later, the pelvic exam. Of course, heterosexuality has changed compared to the past. According to Thomson Innovation Group, only 48% of the 13 to 20 years old identify themselves as heterosexual, compared to 65% of millennials aged 21 to 34. Maybe during the Cold War era, it was important to have a sexual life between opposite sex to have a stable nation. Right now, things have changed and homosexuality has increased. The right kind of sex nowadays is reflected by pleasure and healthy relationships, according to Love is Respect organization. The future of the right kind of sex is probably going to change in the future as well.
A man used to legally require an examination to prove he was free of venereal diseases before he could have a marriage ceremony. Around the 1930s, it was deemed important that the soon-to-be bride be examined as well. The exams focused on introducing the young woman to penetration with a well-lubricated tool and exercises used to calm the fearful virgins called Kegel exercises. These exams were meant to teach women how to react to sexual stimulation, but the doctors didn't necessarily want them reacting in their offices. Clitoral orgasm was deemed a crutch and for use only by lesbians, and that vaginal orgasm would come once the bride had become used to penetration. Today, however, pelvic exams are there only to make sure that a woman is healthy and there are no abnormalities. Instead of prepping someone for marriage, a woman only has a pelvic exam for the maintenance of health. It's only fairly invasive as opposed to the 1930s methods, and usually includes a pap smear, speculum, and bimanual tests to make sure everything is working and looking like it should. Now that premarital sex rates are up, and we figured out that the old methods were a bit invasive and unnecessary, we have since developed new techniques purely for health rather than for sexual health reasons.
During the pelvic exam era, women used to fear going to the doctor because the inspection of hymen would expose evidence of masturbation or could even remove their virginity. Men still favored their women to go take the exams because doctors took over part of their job in preparing the hymen for intercourse. And also, in some states, they still require the premarital medical examination as a prerequisite to obtain certificate of marriage. Nowadays, according to the Islamic Center of or Islamic Circle of North America, Islam still requires a premarital examination to make sure the couples are free of any genetic disorder or diseases. And it says also that it's still offered and requirement in many other countries. To sum it all up, we talked about heterosexuality as sexual interaction between persons of opposite sex or gender. We talked also about physicians as best guidance, best guides for young couple seeking satisfied marital relationship, and physicians' role in transition of female into marital heterosexuality. We finally talked about the premarital pelvic exam and how it used to be in the past prerequisite for marriage licenses. Here are our sources. Thank you so much for watching this presentation.